Welcome back to the Mom and Mind podcast, another episode of Behind the Sessions. I'm your host, Dr. Kat. I'm going to be doing another 4-episode series, this time on the holidays, how to cope with the holidays when you're dealing with either infertility, pregnancy, postpartum, or pregnancy loss. And the series will span the months of November and December. But I also want to note that the things that I talk about on these episodes are tips and tricks that you can use anytime during the year, especially if you're anticipating dealing with being around a lot of people, having to deal with a lot of questions, coming up on anniversaries, or things that are typically more emotionally challenging. And even if you're not specifically dealing with infertility or pregnancy or postpartum or pregnancy loss, there are things in each of these episodes that you could apply to your situation. Again, coping skills, ways to think about how you're doing, how you're feeling, and ways to interact with people in your life. And on this first episode in the 4-part series, I am covering the holidays and infertility, how to navigate when you are hurting. And more specifically about infertility, this is really challenging to deal with on any given day, but even more so when going into the holidays, when there are inevitably going to be a lot more people you're around, people who might have questions or might not have seen you in a while and want some updates, or maybe people that were clued into your fertility journey who want to know how things are going. And a lot of people who are dealing with infertility, going through IVF or other types of reproductive supports, are really anticipating this season and the gatherings and trying to figure out how to navigate how they're feeling while dealing with how other people feel. So I just want to talk about this openly, and hopefully this gives somebody out there a little bit to think about and a couple of ways to potentially cope through this holiday season. Now, the holidays come preloaded with expectations of joy and celebration and gratitude. People are connected to or historically connected to. So in a way, the holidays can be fairly loaded already with pressure or expectations or hopes for how it's going to go this year, or wanting it to match some other awesome, amazing holiday that happened in the past, or wanting to make up for some difficult holidays that happened in the past. We just never know how each and every individual is coming into the holiday season, but we can say it's filled with different perspectives, different expectations, whether they be hopeful and good or dealing with pressure and trying to avoid anything negative. But there's usually a family gathering or multiple family gatherings. And when you're dealing with infertility, walking through this season can sometimes feel like there's a spotlight on you and on everything you're longing for. And most people are coming from a good place when they come to you as a person who's dealing with infertility. They're coming to you with hope and hopefulness. And that's really difficult to navigate because you might not be in a place where hope is what you can hold on to. You might be in a place where you're pretty wrung dry from all that you've been through, and trying to accept other people's hope for you can be really difficult. It can oftentimes feel like you, as a person dealing with infertility and having been on this journey, are having to be available for other people's feelings about your own experience. And you may or may not want to talk about it openly. Some people do, some people don't. A lot of people are somewhere in between. And honestly, it can change day to day. There might be days where you feel okay talking about it, and other days where it's just too raw, or you're just tired of talking about it. But the holidays might be putting this spotlight on something that you've been longing for, but don't yet have. Or you might be coming to terms with possibly not having a child, or not having one that is biologically from you. And maybe for, the past year or more, you've been trying. You've spent the past year trying. Maybe you've been navigating already loads of gatherings people having baby showers or announcements. And then coming into the holidays, loads of people are taking pictures with their pregnant bellies or with their new babies or with their family and holiday gear, matching pajamas and cute little baby photos. And all of that could be really painful to see. Now, definitely, it is possible for you to be able to hold both, that you are both pained from the situation you're going through and also happy for the people that you know and love who, are having those experiences, potentially those experiences that you wanted. But that's not always the case. Sometimes you might feel upset or resentful or jealous or sad. And all of that is understandable and okay to feel, even though we are told that we are only supposed to have all good feelings for all people all the time. It really takes out a huge chunk of our human experience that in light of somebody else's great experience that they want, that you're supposed to just be happy. Humans aren't that way. You can be happy, yes, but you could feel a lot of other things too. And then, even preparing to be around family members, you might be dreading questions, sometimes that are thoughtful from relatives or friends, sometimes that are very intrusive, and sometimes miss the mark entirely. There's a lot of sort of like tried and true things that people just say because that's what you figure out how to say to people when you don't know what to say. Like, so when are you going to start a family? Or when are you going to have your next baby? Or you could be receiving, quote unquote, advice on what you, quote unquote, should do to get pregnant. Anything from what kind of food you should eat, what kind of diet you should be on, to what type of complementary or alternative procedures you should try, supplements you should start taking, tactics you should take, ways that you should talk to your providers, or maybe the well overstated, just relax, it will happen, or the definitely played out, just stop trying, and that's when it happens. I'm sure that anybody who's been through infertility for whatever period of time has heard this or some version of it, some flavor of this, maybe all of it. Maybe you feel like you've heard it all. And you probably want to avoid hearing this type of unsolicited advice ever again. But especially during the holidays, if you're feeling raw, if you're feeling vulnerable. It's a lot. It's can be very painful. And it is common for people to feel alone in that pain. You might be one or a couple of people in your family who is currently dealing with this situation. Not that other people haven't or hadn't, but if you're not currently dealing with it, it's hard to find people who can fully understand where you're at in that moment. They might be able to relate to it, but they might not. And this is pretty challenging to navigate. So with all of that, it's really important to understand some of the emotional landscape that you're in. And I've alluded to quite a bit of it already, but infertility is more than a medical condition. It is an emotional marathon, except you don't know when this marathon is going to end. Yeah, it would be nice to know that, yep, at 26 miles, 26.2, whatever, you're going to be done. And that's it. You have what you came here to get, and done deal. And when you're at the beginning of a journey like that, it can be hopeful and you can have a lot of energy and you can be really excited. But when it's gone on for a little while, however long it's been for you, every month can bring a mix of hope, disappointment, grief, despair, a lot of emotional ups and downs that can feel very intense. And then let's add on top of that, whatever hormonal ride you've been on. If you are working with a reproductive endocrinologist and you're doing whatever treatments are suggested or needed for the procedures you're having, that includes having some cocktail of hormonal influence in some way or another. And for some people, their bodies manage that in an okay way. And for other people, their bodies respond to that in ways that can create other challenges. So, like, your body size may have changed. You might not know when your period is coming. If you're going to get a period, you might be hypervigilant, like on the lookout for those types of things. You might have the clock or calendar of what shots you need to take, when you need to call your RE to set up your next appointment, and so on and so forth. So then you're on this hormonal ride potentially. You're on it during the holidays, which is extra fun. And the grief and the upset can feel bigger, can feel louder, can feel more intense, because the holidays are also a marker of time, just the same way as anniversaries are, or, birthdays, those kinds of things. You might be reflecting like, oh, yep, last holiday, last Christmas, last Thanksgiving, last whatever, you were in whatever stage of this process you were in. And now here you are and nothing has changed. Or now here you are and things have worsened. Or now here you are and you're hopeful again, but you're not quite sure if you can hold on to that hope. And that can be challenging in and of itself. But when you're at a family gathering, when there's maybe a lot of other kids around, potentially babies around, even commercials, holiday cards, anything that kind of hits your particular nerve can feel painful. And you might feel any number of emotions. There's no end to the list, and none of them are off the table. Everything could be coming up as a potential feeling for you. That's both positive feelings and negative feelings. Just please know that all of those feelings are very, very human. They are valid. They are part of love and loss and hope and grief, and they can all feel intertwined, and they can all feel like they're happening at the same time. And this all doesn't even include if you're dealing with anxiety or depression, like a clinical anxiety or depression. And the overlay of that can make all of this feel so much more intense, more isolating, more hopeless, more sad, deeper grief. Basically, anything you're feeling can be intensified if you're dealing with depression or anxiety on top of it. With all of what I've said so far, this is in some ways still kind of scratching the surface of people's experience. It can feel hard to imagine that one person could be experiencing all of that, but definitely you can, and it could have been happening for months, for years. So whatever you're feeling, whatever's coming up for you, whatever the context is, whatever the scenario is that you're coming into the holidays, I'm just going to offer a couple of gentle reframes, some thoughts, some things to think about to help you cope even just a little bit. So what I find a lot of people struggle with is the conflict between what they are feeling and what they think they should be feeling, and how much guilt and or shame that can bring up. A lot of people think, well, I should be happy. I should be grateful. I shouldn't feel jealous. I'm just going to pause right there. It is really okay to feel however you feel. You might not want to feel that way. You might not like feeling that way. You might wish you felt a different way, but here you are. That is how you're feeling. Whatever it is, there it is. It's okay. It's okay to acknowledge that. It's okay to even give context to that. Like, yeah, my emotions make sense given what I've been through. This is, similar to what I say all the time. You would give that same kind of compassion and grace and understanding to a friend. You would tell them, yeah, it makes sense that you don't feel so happy right now, that you might feel a little jealous, that you wish things were different. So if we can just slightly reframe the inner dialogue, catching those shoulds when they come up, or shouldn'ts when they come up, any way that you're trying to talk yourself out of how you feel could be a little flag to you that maybe I'm doing the thing. Maybe I'm doing the thing that makes me actually feel worse. And what would happen if I just allowed that feeling to be there, even though I don't want it, even though I hope it changes, pretty soon, there it is. It's a shift from judgment to compassion and understanding. Another thing to think about for the holidays is you're probably still putting out quite a bit of energy, as happens during the holidays. Maybe you're organizing things or you're getting ready to go see people, you might be traveling. Things typically are busier. And when things get busy and we're stressed, depressed, or anxious, our self-care tends to really take a slide. We're not doing it as much. We're not paying as much attention to what our needs are. And any accumulation of that can make things feel harder. Now, again, I said it's a busy time. So we're not talking about like a full spa day, some full time off of work or caregiving or whatever it is that's on your plate. I'm talking about if you're going into a gathering, you're going to be in there with a lot of people, maybe just take 5 minutes to ground yourself with some quiet breathing, with some centering, with some reminding yourself that it's okay to feel how you feel. And I'll get into some boundaries in just a moment, but that it's also okay for you to not talk about everything that people want to talk about. And again, I'll get into that in a minute, but this 5 minutes can be just focusing on your breath. It can be holding a stone that has meaning for you. It can be focusing on a mantra if that's something that you like, or some type of bracelet or token or something you have in your pocket that you can hold on to if you feel activated or triggered by, a situation or something that somebody says. These like very small moments, even if it's just 1 minute of breathing, to allow yourself some time to transition into a gathering and transition out of a gathering. You can take a couple of minutes in your car or on the train or wherever you're at to breathe, to allow yourself to feel, or if that's not the time to do it, then set a time for yourself to like, okay, that was a lot. When I get home and I kick off my shoes and get in my comfy clothes, then I'm just going to allow myself 5 minutes to just feel the intensity of what that was like and honor that that's how I'm feeling right now. That is self-care. Self-care is acknowledging how you feel, validating how you feel, allowing it to be there, and creating a little bit of space for you to feel your feelings. And then I'm going to talk about boundaries. Boundaries are great. They are fantastic. And boundaries are a form of self-respect, a form of honoring your process and your needs, and are not meant in any way to diss anybody else, but really a way to honor what's going on for you. The most clear boundary is no. Somebody asks you to an event and it's going to drain you, or you're worried it's going to be overwhelming. You might be sad to miss out on it, but if you know that where you're at right now in your life in this state, that it is not going to be good for you, or that that's not how you prefer and need to spend your time, you can say no. That's a hard one. It's relatively simple, but it's very hard to do, to just say, nope, sorry, I can't make it this time. Giving yourself that kind of permission, even if you end up saying, okay, giving yourself permission that you can say no if you need to, or that even after you've said, yeah, I'll make it to, this party, to give yourself permission that, if your situation changes and you need to say no, that you can. And, if somebody's asking you, well, why not? How come you can't come? We really want you there. We really need you there. Why? What are you doing instead? You can say something like, well, I'm just really wanting to focus on my health right now. And part of that means, staying home and resting. Thanks for understanding. And you can leave it at that. You do not need to explain, well, just finished my third retrieval and I'm gearing up for whatever part of your process that you're in. You don't have to explain any of it. It's not required. You don't have to explain yourself or your reasoning. You can say no, and you can just say, thanks for understanding. If you need to add anything into it, using something like, well, I'm fine, but I need to focus on my health and make sure I'm good to go, and whatever, you can leave it at that. Another type of boundary that nobody really even needs to know about or be aware of is just having an exit strategy. If you know that you definitely want to go to this thing, but you definitely don't want to stay, your exit strategy could include like driving separately from your partner so that you can leave when you need to leave. Or you can have a code word with a family member or trusted friend or a partner that signals to them that you need to go. Or you can schedule a short visit. You can set people's expectations. Say, I really want to come to this gathering. I'm only going to be able to stay for an hour. So that you've said it out loud to yourself and to them that have a boundary. And if you decide that you can stay longer than that, then fine. But you've you've set it up so that the boundary is already there. And then when you need to leave and at your hour mark, you can say, well, thanks. It's been awesome. I'm glad we were able to hang out and, I'll see you soon. Your energy, wherever you're at in your process, is important and important to protect. So however it is that you need to set up the parameters and the boundaries, go for it. It is okay. So these are just a couple of things to consider, reframing your thought process to include a little bit more compassion for yourself, saying no, and engaging in small moments of self-care. If this holiday season feels heavy, please know you're not broken. You are a whole human, even in whatever mental state you're in, however you're feeling. It's okay to protect your peace. It's okay to have compassion for yourself and set limits and boundaries. And as we close here, and at any moment, you can take a deep breath and just ask yourself, what do I need in this moment? What do I need in this holiday season? And whatever that is, you can give it to yourself, or you can ask for someone to support you in the way that you need. Thank you so much for joining me here today. I hope this has been helpful for you. Please do pass it along to anyone you know who could be dealing with this during the holiday season. Thank you for listening. Take care of your heart, take care of yourself, and I'll see you for the next episode in this series on coping for the holidays.